Hello, anatomy and physiology student. I wanted to provide you a little bit of information for this week's lab, and this will be for the week of February the 29th. And we're going to begin to dissect the arteries and veins of the cat, and that's going to take quite a bit of our time in lab. If you do it correctly, it'll take time. We'll also supplement the cadaver by using the cat and give you experience doing some dissection and learning some dissection technique. So I'm just going to hurry through this because the file size that can be uploaded into Canvas is kind of small, and if I keep the video short, it'll help with that. We're going to start with the veins, and this week in lab we're going to learn the arteries and veins that supply the upper limb, the neck, and the head. And I'm going to begin with the veins, and we need to begin with the right atrium of the heart. And so here's the right atrium, right ventricle. Right atrium, and then over here is the right ventricle. And I'll just abbreviate ventricle. Now, I'm not interested in showing the entire heart, just the right side of the heart, because the systemic veins are going to carry blood to the right atrium of the heart. And as you know, we have the superior vena cava and inferior vena cava, and you should have identified these vessels last week in lab. We're going to focus on the upper limb and the head and neck today, or this week in lab, and then next week we'll learn the arteries and veins that supply the abdomen and the lower limbs. And so our attention here is going to be focused on the superior vena cava. There are two small vessels that branch off of the superior vena cava, and these are called the brachiocephalic veins. And I think since my space here is sort of limited, I'm just going to number these, and then what you can do is transcribe what I'm showing you here into note form and use that for the end of lab quiz this week, the post-lab quiz. So I'll just label this one number 1 and this one number 2. And in our illustration here, the right is going to be over here, and the left is going to be over here. So number 1 would be the left brachiocephalic vein, and number 2 would be the right brachiocephalic vein. And brachio means arm, cephalic means head, and so this is a vein that's carrying deoxygenated blood from the arm, the upper limb, and the head. Now there's a vein that's going to branch off kind of immediately here, going up the neck, and you may see on one side of the cat, and you'll see this on the cadaver as well, and on the cadaver it's on the right side, one of these vessels is tied. And that's because that's the one they use to inject the embalming fluid, and in the cats, also the blue latex material that colors the vessels. So this is going to be number 3 and then number 4, and so we have left and right, and the vessel here is going to be the internal jugular vein. So 3 is the left internal jugular vein, 4 is the right internal jugular vein. And then there's a branch goes up, and also symmetrical on the other side. And this is going to be labeled 5 and 6. And so in my illustration here, odd numbers are on the left, even numbers on the right. And 5 is going to be the left external jugular vein. 6 is going to be the right external jugular vein. And then this continues something like this. And the vein that continues here we'll label 7 and 8. And 7 is going to be the left subclavian vein. 8 is going to be the right subclavian vein. This continues and branches into two vessels that go to the arm. And kind of drawing this kind of out of proportion here. But this vein here we'll label 9, and we can do the symmetrical kind of arrangement on the other side. So number 9, and then over here we would have 10, and then 11 and 12. So number 9 is the left cephalic vein, and number 10 would be the right cephalic vein. Number 11, this is going to continue down. Number 11 and number 12, they go under the armpit, and so these are going to be the axillary vein. So 11 would be the left axillary vein, 12 would be the right axillary vein. And the axillary veins continue and go down the medial aspect of the upper limb. And so we're going to have on this side 13 and 14, which are just continuations of the axillary veins. And 13 and 14 are the basilic veins. And so we'd have a left basilic vein for number 13 and a right basilic vein for number 14. And then these continue down the arm, and there's a lot of variation from one individual to the next in terms of the anatomy. So what we're going to see here is sort of a generalization. And in fact, when we get into the cadaver, we're going to see that the branches off the aortic arch are very unusual in this particular individual. So I'm just going to draw on the left side here. There's a vessel that will connect these two together. So the cephalic and basilic veins come together, and where they come together, I'm going to label this number 15. And there would be a similar arrangement on the right side. 15 is going to be the left median cubital vein, the left median cubital vein. And that is often a vein that's used clinically to draw blood. The veins then continue down from about the elbow down the antebrachium or forearm, and so the basilic and cephalic veins would continue to go down the forearm, and that's where we're going to stop. So as you go through these vessels, the best way to approach it is to think of where you're starting. So you can think of this analogous to a map that you're drawing to show directions from your house. So from the right atrium, you take a route going to your final destination, which is going to be in the left upper limb, in the antebrachium of the left upper limb. That's the left forearm. And blood's going to have to go through, number 1, well, first through since it's going back to the heart, it's going to start over here. Number 13, which is the basilic, or number 15, the cephalic, or sorry, number 9, the cephalic, or 15, the median cubital vein. So blood's going to come from one of these directions: median cubital vein, cephalic vein, or basilic vein. Join the axillary vein if it's coming from the basilic vein. All of these are going to join the subclavian vein, which join the brachiocephalic vein, which then empties into the superior vena cava. So think of it as a road map, and when we do the arteries, think of it the same way. So draw this out and use it as your notes for the end of lab quiz, and we'll have another one for the arteries as well.